Okay, the non-opioid analgesics, acetaminophen. It's an analgesic, it's an antipyretic, but it has little or no anti-inflammatory effect. It is available over the counter, and it's in a lot of other drugs. Be very careful. You got to know your drugs, because acetaminophen is in many pain pills in one way or another. It acts on the periphery. It blocks the pain at the level of the actual tissue damage. It's used for mild to moderate pain or for fevers, and it is an alternative for the people who can't take aspirin products, such as children. It is possible to give too much of this. Even though it's available over the counter, overdose can be lethal of this drug, of acetaminophen. It causes hepatic necrosis. That's liver death. Long-term ingestion of large doses can also cause nephropathy. The maximum dose for healthy adults is 4,000 milligrams per day. The extra strength pills that are available, if you read them, they say only every 6 hours, whereas the regular strength, you can take them every 4 hours. So it's important to look at the total amount a person is getting in a 24-hour period. It can be dangerous when taken with alcohol. Think about it. This one can damage the liver, alcohol can damage the liver, so they shouldn't be taken together. And we should not be giving them if a person has any kind of liver dysfunction, possible liver failure, or they're taking any other kind of hepatotoxic drugs. Okay, nursing implications for analgesics in general. As with everything else we've talked about, assessment. What are they taking? What's their life like? What kind of medical problems do they have? What kind of drugs are they taking? All that other kind of stuff. What's their baseline vital signs? What's going on with I&O? Look for the potential contraindications and drug interactions. Now, let's perform a thorough pain assessment. How much does it hurt? What's the pain like? Is it stabbing? Is it aching? Is it gnawing? What's going on with that? 0 to 10, what's it like? 0 being the least pain you can ever, no pain, and 10 being the most you could ever imagine having. Where are you right now? Where is the pain? What makes it better? What makes it worse? What have you tried? What have you been using? Remember, pain is the 5th vital sign. It needs to be routinely assessed, and not just the 0 to 10. You need to do more than that. Be sure to medicate patients before the pain becomes severe, and provide enough medication. Now, it's going to take you a couple tries to get that right. But like I said, you believe the patient. What they tell you about their pain, you believe them. Treating pain before it becomes severe you'll actually use less pain medication in the long run by doing that. By preventing pain is more efficient than trying to make it go away. Pain management, again, we give drugs and we don't give drugs. Both. You give them the medication, and then you do something else. You use diversion, you use massage, you use warm compresses, you use ice. Many people in Western society don't value ice enough. They haven't given it a try. A good ice treatment used properly, because you can damage somebody, but used properly is sometimes more effective than heat. So all these other things, relaxation, hypnosis, all of these other things are just as important as the pain medication. They should not take other medications, even over the counter, without checking with their prescriber. Like I said, acetaminophen is in a whole lot of over-the-counter drugs and a whole lot of prescriptive drugs. We don't need to kill somebody's liver because we didn't check it out. And as with every drug, you tell them about the signs of allergic reaction and have them call if they're having any of those. Okay, what are the implications when giving opioid analgesics? Well, they tend to irritate the stomach, so give them with food or liquid of some sort. Ensure safety measures, such as keeping the side rails up. Fall precaution kind of stuff. It tends to make people confused and sleepy and drowsy, so be very careful and to protect people's safety with this one. If your vital signs are going down and you got less than 12 breaths per minute, don't give any more drugs. Don't give any more opioids. You need to call the physician and check dosages carefully. There are lots of different doses out there of morphine. They come prepackaged. You want to make sure you're given the right one. Follow the administration guidelines for IM injections, and that's including site rotations. Some of these, you keep putting them in the same spot, you've built up bruising and scar tissue, and it won't work as well, so you need to move it around. And again, make sure you're double checking, triple checking IV administration. You've given the right amount of drug in that IV, you've diluted it appropriately, you know how fast to give it over. Constipation is common with people taking opioids, so we need to talk about all the diet stuff to help to try and overcome the constipation. Drinking lots of fluids, lots of fiber in the diet, including getting up and taking walks, trying to get some exercise as they can safely tolerate. Letting people know about keeping track of their own pain and their own experience and what it is they found that helped to relieve their pain, especially if they're living with chronic pain. Changing positions helps. Yes, if they're in severe pain, the physical act of rolling over can be pretty bad, but getting them into a different position is going to overall help them with their pain management. And as with, again, we do with all drugs, let's look for the adverse effects. We're looking for central nervous system depression. What are all the vital signs, the changes you think you're going to see if we're having central nervous system depression? That includes respiratory depression. We're going to be looking, is the drug working? Well, they should be feeling better. It should be easier for them to move around. They should be able to do their ADLs better. Their appetite should be better. They should sleep better. People in pain sleep. They don't sleep well. It's not a restorative sleep, but they sleep. So relieving their pain, they should be sleeping better, getting a better quality of sleep. But you don't know all of this stuff unless you ask them. You have to talk to them about it.